There are many treatment options for patients with uterine fibroids, and there are treatments that are very minimally invasive or non-invasive, and then there are very aggressive treatment options. And a lot of the decision to determine which treatment option is best for you depends on how severe your symptoms are and the size and location of your fibroids.
There's as simple as watching and waiting for the patient. The next would be a hormonal therapy, very non-invasive. There's a few different types of hormonal therapies that we use.
You can also use several medications to decrease the symptomatology or perhaps even shrink the size of some of your fibroids. Some additional treatments that can now be performed with radiologic guidance provide a good intermediary between just very conservative therapy and surgical options. And these intermediary therapies are called uterine artery embolization and MR-guided focused ultrasound, or Curawave. It's actually a non-invasive procedure. Nothing enters the body, no cutting of the skin, no catheters, so the recovery time is almost immediate. Now with the uterine artery embolization procedure, it's still considered a minimally invasive procedure because it involves catheters going into the body, and there is a significant recovery time of usually 2 to 4 weeks. Some of the more aggressive treatment options involve actually taking the fibroid out, like a myomectomy, or a hysterectomy, taking the uterus out, and those surgical procedures can be performed in various manners, either transvaginally, laparoscopically, robotically, or through an open incision.
The less invasive tend to have less recovery time. The more invasive tend to have obviously more recovery time, going from 0 days to 4 to 6 weeks of recovery. These are things that are important to discuss with your gynecologist or your radiologist or whoever is treating your fibroid.
The distinct advantage of having a hysterectomy or taking the uterus out is that you take care of the fibroid problem once and for all. No uterus, nowhere for fibroids to regrow. However, there are some risks of having a hysterectomy as well. First of all, there's a 2 to 6 week recuperation period. There's the surgical risk for bleeding, infection, and the anesthesia risks. And finally, in addition to the risk factors of the surgery itself, you also lose the ability for further reproduction.